Dr. Ritamarie, so excited to have you on the show, on the interview, and I'd love for you to give everybody a rundown of what you do, how you got there, and why it excites you.
Ah, yeah, where to start? So I would consider myself a metabolic recovery specialist, and I've been a doctor of natural medicine, functional medicine for a long time, over 3 decades. And I'm passionate about helping people to see what they don't normally see, to see that so many of their health issues have to do with their blood glucose and insulin regulation and the way that their metabolism gets out of skew. And it's something I feel is not addressed often enough in conventional Western medicine. And so many people get such great results when we focus on that.
Amazing. Can you touch on what does it mean to be a metabolic health recovery specialist? How do you define metabolism, why you went down that route, and why it's so important?
Yeah, so metabolism is how we interface, how we take in the food and the nutrients and then get them into the right places to produce energy so everything in the body can function. So metabolic health affects all the hormones, it affects the digestion, it affects how the brain operates, and it's affected by so many things. And when we look at like the recent study that was put out, actually the first time it was put out was in 2018. University of North Carolina posted it in metabolic, I think it was metabolism. I forget the exact name of the journal, but it was a metabolic journal. And they found that 88% of the population in 2018 was considered to be metabolically unwell. And when they republished in 2022, April of 2022, it's now 92% of the population. So I've been focusing on it for a long time because I see, as I was working with people one-on-one in private practice, that they wouldn't even know that they had blood sugar irregularities because, oh yeah, your blood sugar is 90 something, but the way they were describing their problems. So I started back then, having them buy a glucose monitor and measure their blood glucose. And figuring out, like, how do we figure out their peak and how do we figure out what foods, what diet, exercise things, what things were causing them to go out, and then helping them to maintain their blood sugar within that nice narrow range. And miracles happen. So that's when I decided to take this, to a wider audience. And back in, I think it was 2011, I did my first program. We had 100 people join our program and we took them through this whole metabolic reset, and miracles, literally miracles happen. So I'm passionate about it. And the more I look at it and the more I talk to colleagues, they would be like, huh, you do what? You have non-diabetics measure their blood sugar. This was 12 years ago. Now more and more people are becoming aware of that. CGMs are, people, it's practically a household word these days. But back then, CGMs weren't available readily to the public, but blood glucose meters were. So yeah, it's a passion of mine.
Very cool. I'm curious to know, since you were so ahead of the time, right? Like you were like you said, not a lot of people were measuring blood sugar 12 years ago. I mean, even 3 years ago, it probably just starting to hit that curve now. If we want to look at data and trends and stuff like that, and companies that are coming out, making them more popular. What kind of led you specifically down that road? Like, how did you decide that was the way or the path forward for people to get better versus some other paths that, other functional holistic medicine practitioners take, which is, let's optimize your gut biome. Let's do, testing for allergens and if you're toxins and mold. So there's a lot of different areas that we can get into as well, to see if that's something that you incorporate. So why was it so important to go after blood sugar data and looking at metabolism through that lens?
It's a great question. And yes, and I looked at all of those things, right? I always looked at what people were eating and the food sensitivities. And what I started to see was that some people responded really, really well to a very low fat, higher carbohydrate diet. And other people just crashed and burned on it. And then other people did really well
Mm.
on a lower carbohydrate, higher fat, all good fats. And so I started to play with it. I started doing the experimentation with people, and I realized it's very individualized. And I said, well, how could I measure that? How can I figure out which people are going to respond well to one or the other? And then I started measuring. I mean, we measure fasting insulin. Nobody's measuring fasting insulin except on diabetics to see if they need insulin, right? Nobody's
Yeah.
looking at high levels of insulin as being a contributing factor. So I just started down that route. And what really got me so much more interested was when I started my first blood sugar balancing program, and I mapped out how people were going to measure their glucose. And I had a old glucose monitor that I said, oh, I need a new one. So I went out and got a new one so I could evaluate. And I tested my sugar, and it went from 68 to 168 within about 30 to 40 minutes after eating a bowl of pineapple, not a bowl of M&Ms, nothing high carb, bad carb. And I'm like, oh my God. Right. So I started getting much more like with fine tooth combs into people to determine for each individual what was their pineapple. Some people could eat all the pineapple they wanted to and their sugar didn't go up. And other people would eat like me a little bit. I ate blueberries and my sugar went up. And I went, okay, why is this so? So then I started looking at the genetic factors and realized that of all the so far identified genetic factors involved in blood sugar management, I was like, I have 75% of them probably. So I thought about that. And then I thought about, well, what are the complications, right, of people having elevated insulin? What does that do to blood vessels? What does that do to the endothelial linings? What does that do in general to other risk factors? And started to see all the evidence that cardiovascular disease, cancer, et cetera. Looked at my own family and said, my mother died suddenly at 56 of a heart attack. She had no diagnosed condition before that.
Yeah.
My grandmother had type 2 diabetes. Everybody in my family has the poor waist hip ratio, let's just say. So I started putting it all together and realized that, had my mother been given the kind of advice and the ability to test the way I'm doing now with people, would she still be with us, right? Would we have been able to turn things around for her? And then I thought, well, what about the people who are still here? How many of them can I help turn this around?
Very cool. And so as you've gone down this path, you obviously did some genetic testing. How do you feel like that's actually super important? Or do you feel like that's super important to get results? Or is it more so that as long as you can see data and experiment with foods and see that data in real time, let's say, or even on a finger prick, maybe not exactly in real time, but over a certain set of the day, do you feel like that is just as powerful, or do you feel like combining some genetic info would give you X result?
I think that the genetic info helps because it motivates people to actually do what I tell them to do. Right? Because they say, I have that genetic tendency, I better listen. And I find that true of genetics in general, whether it's for blood sugar maintenance or whether it's for exercise, frequent fats intake, whatever, that people, when they see it on paper, they get motivated to do it. But seeing, the results of a CGM, seeing the results of regular postprandial finger pricking and getting glucose numbers, that motivates people, right? So what we have to do is get people to actually take action, right? And whatever it takes to do that. So is genetic testing absolutely mandatory? No. I mean, I don't learn a whole lot from that because I can guess that they have genetics tendencies towards poor glucose metabolism, just by how they respond to food. When I first started out, I don't remember where I read this statistic, but it was like 25% of the population can eat crap, can eat whatever they want to, and they generally don't end up with blood sugar swings that are all over the place. 25% of the population can eat pristine as can be. They have to be very careful about defining their food to get good blood sugar control. And there's a bunch of people in between. And so I can generally estimate by how people respond. Oh, look, I had 3 blueberries and my blood sugar went from 95 to 140. I bet you got some genetic things that are going on because you didn't say you just ate a handful of M&Ms and it did that.
Right.
Yeah.
Okay, that makes sense. And so going a little bit further than that train thought, is it hard for people to make changes or take action, in your opinion?
They think it is, yes, right? Most, if it wasn't, people would just do it. And the problem is society. The problem is the pressures, the peer pressure. The problem is the commercials on TV and the billboards and everywhere you go.
Mhm.
It's normalized to eat garbage food. It's normalized to eat sugar. My husband sends me this thing, CNN posted how important it is. This was an article, I think just today. CNN posted this article that says how important it is to look at sugar in relationship to cardiovascular disease. The new research, I'm like, new research. I've known about that research for the last, 2 decades, but
Yeah.
to them it was new, right? And they went through this whole thing about trying to get people not to eat sugar, and that, sugar in fruit or whole grains is not a problem, but flour and even juices, fresh fruit juices and all that, because you're removing the fiber. They did a great job of handling that to get people's awareness. But at the bottom line at the end, they said, so bottom line is we shouldn't have more than X grams a day of added sugar,
Mhm.
separated, pulled out added sugar, which amounts to about 6 teaspoons a day for females and 9 for males.
Yeah.
What? Like zero, zero. We shouldn't be eating any of that, but 6 teaspoons, that's a lot of sugar,
Yeah.
right? That's a lot of mitochondrial dysfunction. That's a lot of insulin destruction. That's a lot of damage to the lining, the endothelial linings. That's a lot of cancer. In fact, cancer cells have 10 times the amount of insulin receptors on them as normal cells. So you eat sugar and you have any kind of cancer cells going on, and we all do. They come and they go, they come and they go, but they light up and they grab that sugar. Your cells don't get it. The cancer cells do. You're feeding cancer. Otto Warburg, back in the 30s, defined that mechanism. So yeah, it's hard for people because of the peer pressure. It's hard for them because they get addicted to these foods. But when in reality, it's harder to get your chest cracked open and your heart pulled out and, having to have bypass surgery. That to me is a whole lot harder than skipping the M&Ms.
Mm. Lots of good pathways there. So let's unbuckle those one by one. The first one being, which is something interesting that you brought up, there's some records of data showing sugar relation to cancer cells. And, there's this saying, and at least in some communities, that cancer cells can't live in alkaline environments and they feed off sugar and all these things, right? And so if that's been around for so long, and now, like, let's say modern day today, this is February 15th, 2023, we have finally CNN covering some aspect of this. Why do you think that is? Why did it take this long for like a mass media outlet to cover something like this, to cover this research, for it to be well known and actually accepted? Because I don't feel like it, correct me if I'm wrong, from your point of view, even, it's not actually accepted yet. And there's going to be lots of people that will argue that point.
Yes, absolutely. And who's going to argue it the most is the food manufacturers, right? So they have money and they subsidize the FDA and other federal agencies. And they, donate stuff to school lunches and hospitals and all these places where we're supposed to be helping people to be healthier. And so there's going to be a lot of pushback and surprise that I think if they hadn't put that thing at the end, like, oh, you can still have 6 extra teaspoons they would have probably lost some sponsorships.
Mm-hmm.
Right? They're being sponsored by pharma and they're being sponsored by food. Go watch any TV shows and you'll see that. Yeah.
Okay. So that all makes sense. And then kind of going back to, is it harder to have open heart surgery versus not eating M&Ms, right? So I totally understand your point of view there, and it's accurate. Is it safe to say though that people, so in general, one of the things that I've learned over the years is, so people are very bad at predicting the future. For example, people think today is 5 years ago, but a little bit different versus like that. Nothing could be further from the truth. Like we have AI, we have crypto, we have SpaceX, we have all these technologies that
Right.
biologicals, we're altering DNA. So it's like, no, we've developed in such ways where it's astronomically different than 5 years ago. But
Right.
in our brains, we're like, no, it's not, right? Until you watch a TV show from the 60s, you're like, okay, there's some difference there. It didn't improve slightly every five
A little bit
years.
different.
Yeah. So kind of combining that train thought with, if people are that bad at predicting the future, then are they also really, really bad? I'll give you another example of not caring about 10 years from now because their brain is not able to. It literally can't think about that. And then just to kind of add insult to injury, is it also a combo of everything you're talking about? Like they're being bombarded to eat this food. It's everywhere. It's readily available. It's highly addictive. It's been scientifically engineered to be that
It'd
way.
be highly addictive.
Yeah. So
Yes.
then it's like all of these forces are telling that person who cares? Just eat the damn cake, right? And then what's
Yeah.
going to happen in 10 years? You might have a heart attack going under a knife. 10 years is so far. It's going to be probably a little bit different than it is today, which is not true, right?
No, but maybe
No.
they'll get saved or something. But the
Yeah.
problem is,
Yeah.
it's not necessarily 10 years. If my mom at
Yeah.
56 would have thought, oh, I'm fine, which she did. I just want to die happy. I'm
Yeah.
young. I can just do whatever I want. 10 years, she would have at least had another 10 years. But
Mhm.
she just went like that. My
Yeah.
dad, 2 years later, the same thing. 50% of all people, of all men actually, with heart problems, with issues with their heart, their first sign is dropping dead of a heart attack. And 65 or 62 to 65% of women.
Yeah.
So you don't even know. Now, if you're doing a lot of extra technologies and calcium CT scores and specific kinds of angiograms and specific
Yeah.
advanced lipid panels, you may have a clue that you're at higher risk, testing your insulin levels, et cetera.
Mhm.
But the average doctor and the average PPO, HMO, average hospital, average practice is not doing any of that. And they're not telling people that how you're eating, how you're drinking, get off the smoke, get the stress levels down. They're not telling anybody that. So I agree with you. Like, it's really hard. I tell people when I'm doing trainings, I say, I want you to just future pace a year from now. Think about where you are now compared to a year from now. And you have all these symptoms. And usually these people have the tip of the iceberg symptoms, like the
Mhm.
brain fog and the belly fat and the exhaustion and those sorts of things.
Yeah.
And I said, that's just the tip of the iceberg. Here's what's happening underneath to your blood vessels, to your insulin receptors, to your brain. And where do you think you'll be in a year? Even with just those tip of the iceberg symptoms. And they're like, oh, yeah, we can turn that around. And
Yeah.
we've literally turned it around. We recently did a 5-day fasting while feasting, it's called challenge,
Mhm.
where we had people do the Walter Longo diet of, high density of nutrients, low calories, specific ratios of carb, protein, fat. And we had them do that for 5 days. And on day 4, we had a woman who'd been diabetic for like 15 years on medication, on oral medication plus insulin. And she said, my glucose dropped to 54 yesterday. And I'm like, call your doctor immediately,
Yeah.
because your doctor needs to adjust your medication. Because if it goes lower than that, you can go into a coma.
Yeah.
She said, I already dropped the oral medication. I contacted the doctor. The next day she reported back, and the doctor said, drop your insulin to 60% of what you're doing and just watch the numbers. And he gave her specific instructions as to how to get off insulin. This was 4 days. Imagine what you can do if you continue this ongoing for 3 months, 6 months, a year.
Yeah.
All these people that are dying of diabetes complications or suffering or being amputated or having dialysis, going blind from complications of diabetes, all this stuff can be turned around like that.
Yeah. And which is a great point. I think Tony Robbins is famous for saying, well, two things: in your moments of decision, your destiny is shaped, right? Which is true. So every decision you're making is stacking itself to an outcome. And then change happens in an instant, doesn't have to take over a long period of time. So if you change a thought or a pattern right now, you technically changed it now, and you can keep doing so, which both things I agree with and are sound philosophies. I want to poke a little bit at somebody does this 4 or 5 days, like you did, like you said, gets the result, feeling better, insulin's coming down. How do you avoid the barbecue on Sunday or the hot dog event with your family when you go watch the football game, right? Because it's and I like your opinion on this. It's like I think a lot of the time the problem isn't that people don't know they should be doing something. Like everybody knows you should diet, have a healthy diet of whole foods, and do some exercise, right? As a base level of,
As a baseline, but they don't know
yeah,
what that means though. They don't actually
exactly,
know what a healthy diet means. They
yeah,
think that means that, they're not eating M&Ms anymore.
right,
Um,
right,
and how do you avoid them going back? That's a great question, because that's the ultimate question of the day,
yeah,
right? She was dedicated from that 4-day event. I offered them to get into a 9-week program, and we're
yeah,
going to get them, or we're going to work with the big why of why do you want this? And
yeah,
what are you going to keep moving towards? And we give them tools and resources, like the choice, there's these forks in the road that happen so many times every day.
yeah,
And when you look at that, I look at what do we need to make a different choice, right?
yeah,
What do we need to make a better choice? Well, we need knowledge. We need to know something about the difference between the two choices and how they're going to affect us, how they're going to actually impact my life. We need tools. We need resources. We need, what do you take to that thing? I give them pizza recipes that are completely
yeah,
blood sugar friendly. Cauliflower crusts and cashew cheese, whatever else it might be. I give them the recipes. I give them the dessert recipes. And then we meet with them every week to
yeah,
go through. We train them and we teach them. Do all of them stick with it? No. Some of them don't. And some of
yeah,
them come back and do the program again with us because they fell off the wagon. My
hmm,
goal is to it's so that nobody ever has to come back and do it again. Reality, we're in the real
yeah,
world, right? But
hmm,
this woman is like, I don't want to be on insulin anymore. And then she asked me some questions about why she had certain patterns, and I explained it to her from a physiologic perspective. I've asked my doctors this for 15 years and nobody's ever given me an explanation like that. That makes total sense, right? Makes total
gotcha.
sense.
Hmm. So it sounds like your answer to me is people are going to fall off. It happens. They can get back on track, right? So it's like, as long as you keep getting back on track, and maybe, I'm not going to put words in your mouth, every time you do it, you're maybe prolonging how far you can take it until you fall back off,
Yeah.
potentially, right? And so to achieve that, it kind of sounds like your methodology is everybody needs guidance, resources, and accountability
Yeah.
stacked below. I think the main reason being like, why am I doing this every single day? Right? Is that an accurate? Did I
That's
depict what
very
you said?
accurate. Yes.
Okay. Yeah.
Focus on the why, stay centered on the why. In fact, the first day of this program, I had them think about the why. Why were they even doing this 4 or 5 day program? And to write it on a card. And they were like drawing pictures on it and telling me how they pinned it to their mirror and they pinned it in the kitchen. And
Mhm.
so we give them tools and resources to stay focused on why. I kept
Yeah.
up with one of my favorite phrases, which I learned from one of my clients years ago, which is, don't exchange what you want most for what you want in the moment. And
Yeah.
so whenever that chocolate cake, those Super Bowl goodies are like calling your name, you think, what I really want is, right? And so they have to keep doing that and keep exercising that muscle. But on
Yeah.
top of that, they need knowledge of how things work and why they're going to do certain things and what they should be doing. They need tools and they need support. So those things help them to make better choices. Are they perfect? No, by no stretch. But so
Yeah.
many people get so much further. And when they do come back, they already have some good muscles built. You just have
Mhm.
to keep working on it. Kind of like going to the gym. You don't go to the gym for a week, build up some muscles, and then be done with it. You get to continue it for the rest of your life.
Yeah. So that's a great kind of point to leave it off. I want to go into something else that you said that I think is really interesting. You mentioned the client that you had said, "Why hasn't my doctor told me this in 15 years? Doctors don't say these things to their clients, etc." Is this, and I've had this conversation with a lot of MDs and functional medicine doctors. So I'd like your opinion on it. It's always nice to see where people land, but do they tell them? Because doctors always say, we always start with, you should diet and exercise. Nobody does it. So then we have to just they're confined to what they can do, right? So if they tell you something, you don't do it, and then they are supposed to, in the industry they're in, give you a medicine or a pill or whatever, then they also have to look at, are they going to get sued? Is this legally something they can do? Which I think a lot of people always miss that part, is like litigation in the US is really, really high, especially in the healthcare industry. So like if you lose your practice, imagine you're studying for 12 years, you're a doctor for one, and then you lose your license. That's a disaster. And everybody's trying to avoid that, right? So why do you think that it's went this way? And why do you think that doctors don't want to go more into the reasons that you give your patients currently in the US?
Number one, most of them don't know. Most of them don't have a clue. I train health practitioners, I train doctors, nurses, naturopaths, chiropractors, all kinds of health practitioners in our nutritional endocrinology practitioner training. And the doctors tell me, like, I wish they taught it to us this way in medical school, right? I would understand how to help people. And some of them cry over the bad advice they gave because that's what they were taught. Right. This is the way it's taught. And a lot of them, litigation problems, sure, they're afraid to go beyond that. But imagine you've just spent, 8 years of your life studying, spending your hard-earned money, hours, long hours in the residencies and all that, to find out that you were only given part of the picture, that you weren't given the full picture, that you were just taught how to suppress the symptoms, not to really fix the underlying cause. Right? And then the system is mapped out in such a way that I got one of our docs is in the UK, in the NHS. She gets 9 minutes for an appointment. There's not a whole lot of education you can do. So the system is not set up to help people get well. The system is a sick care system, and it's there to help people pull the battery out of their smoke detectors when it goes off and hope for the best that the house doesn't. That's my opinion.
And I think that's similarly shared. That opinion is quite common, at least in the, let's say, the holistic functional medicine community. Everybody shares, or anybody that's become something other than an MD has shared that common thread, let's say. Do you have an opinion on why it's shaped out to be this way? And is it changing at all?
Okay, so is it changing at all? And so why is that so much of the education comes from pharmaceutical companies? They learn this for that, this medication for this. Oh, if this medication doesn't work, try this one and this one. And the other piece of that has to do with when they're taught this stuff, they are taught that it doesn't matter. Food doesn't matter. They get 3 hours of nutrition education. They're not taught that food has anything to do with how the body works, which is totally ludicrous. But if you're not educated in that regard, and you feel like what you've learned, your education, your brain real estate is threatened by it, that maybe it's wrong. That's threatening, right? And that's like, nobody wants to sign up for that. So there are a lot of doctors, if I didn't learn it in medical school, I don't want to deal with it, right? And others who go, oh my God, I had no idea. Oh, wow, that's so amazing. And we get a lot of those in our programs. They're just thrilled that they actually can help people rather than just give them some sort of prescription.
Yeah, and it's really interesting. So is the point here that pharma and big food has such a stranglehold on these industries that you're then taught to be in the confines of these industries, and therefore that's the only way. And then on top of that, if you go outside of the confines of these industries, you're probably going to get sued and lose your license, or bad things are going to
Right.
happen,
Bad
right?
things are going to happen, right? How many people, like, look at some of the giants in functional medicine, Jonathan Wright, who, like, so scientific, everything is scientific, everything is based, and his clinic gets rated. And all the people say, but he helped me. He was the only one that ever helped me. Nobody cares because he was not pushing the pharmaceutical line.
Yeah. Which is, so it's basically even the practitioners and people trying to help, because I truly believe, at least for the majority of people who go into medicine, they're going there. Sure, it's a lucrative career, let's call it that. And sure, sometimes parents push children to be doctors because it's a prestigious thing. It's going to make the household name look good. And it's a position that probably will never die, right? Like, in terms of,
we're always going to need them.
So let's table stakes those reasons aside. I think at the core of it, even if you commit 8 years of your life, you want to do good by people. But then you get stuck in this kind of loophole where you're like, okay, well, this person came in, I have 7 minutes with them. I think that's the average for the US, unless it's changed. I think it looks like it's 9 minutes in the UK. What can I do right now to help? Right. And it's like, well, I don't really know anything other than what I've been taught. And so I'm just, here's the pill and hopefully you get better, or, we wait until you're worse and we give you another pill. Is that a fair kind of assessment of?
That's it. And so a lot of people are courageous and are willing to step outside that model and say, no, I can't, I got in this because I want to help people. I'm sick and tired of just keeping people alive. I want to help people to thrive. And when they see this potential of functional medicine, the potential of some of the alternative things, they go, okay, I want to learn this. And more are. So the other part of your question was, do I see it changing? And yeah, I do. Because more and more conventionally trained doctors are stepping in and learning functional medicine, holistic approaches. And this was a shocker to me. I was doing some research the other day on, the specific mechanisms by which endothelial function is affected by insulin and blood sugar. And there was this thing that came up on cancer. I was looking at cancer as well. MD Anderson, right? Cancer center, well-known cancer center. And they were saying, here's what people need to do. You need to get your blood sugar and your glucose under control. You need to get this, 10% of your body fat off at least. You need to be exercising. You need to be eating whole, fresh foods, mostly plants. And I was like, whoa. Why didn't this make front page news? Why isn't this plastered all over the place so people see that a prestigious cancer hospital is saying what we're saying as functional medicine and alternative type practitioners? I don't see it as alternative either, but that term is used a lot. It's complementary. We can't do away with Western medicine. We need it for urgent care. We need it for trauma care. We need it for when people haven't been doing the right things and then they're, on the unit and they need pumping and get them alive. But what do we do after that to keep them from landing back in the ER? That's the piece that's missing.
Yeah. So that's a really good segue, I think. I'd like for you to kind of expand on what is functional medicine and why does it sometimes get coined as alternative, and then why is there this, because there is some animosity, at least in not all groups of people in these two buckets. I'm gonna preface it with some people that are MDs will call functional medicine quackery. There's nothing to it. You're basically getting ripped off. And then some functional medicine doctors will retaliate and or have the opinion that MDs are nothing but pill pushers. They don't actually care. And again, I'm saying there's like loud people in each of these facets, but they are there and they talk pretty loudly about this. And so then it confuses consumers. And I think it maybe, if they were thinking about one way or the other, are now conflicted and they're not getting any care, right? So why do you feel like, since you've been so long in the health industry, do you feel like you've seen this come up? Do you feel like there was some like event that made this the way it is? Or, what's your opinion on this kind of topic where they go back and forth at each other's throats a little bit?
Yeah. So here's the thing. Allopathic, functional, right? Functional meaning we're looking at the body, we're looking at a person as having specific function. And when there's symptoms, when something's wrong, it's not something we label as a disease and then throw a drug at it to suppress it. It's an imbalance in the body. So what's an imbalance of? Yeah, it could be a nutritional imbalance. There could be a hormonal imbalance induced by stress, induced by lack of sleep, induced by eating all day long, right? So there's all these things, but we're looking at the function. Everything we're looking at is functional. And then we look at how do we get the person back in balance? Is it with food, nutrients, herbs, lifestyle, all of the above, usually. Allopathic is generally the practice of identifying and calling and labeling a disease with a diagnosis. And that's what the whole medical model with insurance especially is based on. What's the disease code? And what are you allowed to do to treat it? And even some drugs people get flack for using drugs in off-label purposes when they find that, oh, this actually works for that when it's not approved for that. And doctors can get in trouble for that, right? For using things off-label. So it's why are there differentiations? Well, I think a lot of allopathic doctors, especially those who've been in it a long time, feel threatened. They feel threatened. It's like, oh, they're going to take my place. Oh, they're just quacks. They don't know much. But when you really look at it, I mean, functional medicine, I do a training program, a 2-year certification in nutritional endocrinology, which is basically how do you balance the hormones using diet lifestyle principles. And it's very science-based. And that's why our medical doctors who go through it say, wow, I wish they taught it to me this way, because it makes sense that, we address deficiencies. Now, here's one thing that bothers me from a functional perspective is that there's a lot of doctors from an allopathic perspective that go, oh, this makes sense. These drugs are dangerous. We don't want to give all these drugs. So they go into and they do what I call allopathic naturopathy or naturopathic allopathy, something with where you combine those words, where they want to go to, oh, what herb do I use for this condition? What nutrient do I use for that condition? And that's not part of functional approaches. The functional approach is what's out of balance? How do we identify where the imbalance is, whether it's a nutrient imbalance, a nutrient excess, a toxicity thing, a food sensitivity, a hormonal imbalance, insulin excess, et cetera, et cetera. We identify that. And then we say, how do we help that person? How do we empower the person to take action? Whereas allopathic is more of a passive type of thing from the standpoint of the patient. Here you go. Here's your drug. Take it. Come back in 6 months. We'll see how you're doing. Versus in functional, we're talking to people about changing habits, going back to the very beginning of our conversation, changing our habits, changing the way we eat, changing the way we think so that we can bring it all into balance. So yeah, there's always going to be factions, but it's not something that's, they're not mutually exclusive, right? We need allopathic medicine when somebody gets dragged into the emergency room with a gunshot wound, or just fallen off a ledge, or just had a massive MI and we're trying to get them back. But where functional comes in is how do we prevent, not so much the traumas, because we can't do that, but how do we prevent the person with a stroke, a heart attack? How do we figure out why they had that and then change the parameters around it so it doesn't happen again?
Gotcha. Yeah. And that's great context, obviously, through years of experience and dealing with both sides, I'm sure. So thank you for going into such depth, because I think these are questions that I see get asked a lot and a lot of people get confused about all the time. So it's really good to have you point out, like, here's where we need both sides to come together and not demonize each other where it's like one or the other, right? And I always tell people, like, when they find out my story, I used to have 7 doctors at once. from every single area. It was like Chinese herbs, functional medicine practitioner. I had an energy healer. Like it was basically like, I told them I was trying to use everything I could from every source of knowledge that I had because I
Yeah.
didn't care. If the energy healer somehow got me better, I was like, I don't care, right?
I
Like
don't
I'm
care
not,
how it happens. I just want to be better.
yeah, I'm
Right.
like, even if it was all placebo, I don't care. Like, because I'm
Yeah.
like, the whole point is to get healthy. The point isn't to, and I think what happens, I'd love your opinion on if you've seen this, because you've been around for a long time in the health industry with different diets. I've seen this happen a lot where people go, okay, I'm paleo and it helps them, right? And then they want to maybe not be paleo, but then they're like part of a tribe. So then it's hard for them to speak out against it, even if they change their mind, right? And
Yeah.
so like this tribe mind or hive mind thing starts to happen where people
Yeah.
will do something, they feel like they're part of something, which belonging, I think, is one of the most powerful things you can have
Mm-mm.
as a business, community, personality, movement, whatever, right? And so do you think that that's part of why all of this always happens is like people cling on to something and then something comes and it's like, oh no, they're going to disrupt our what we thought was the perfect, solution and forbid that like anything there could be good, right?
Exactly. I totally get that. And I talk about it all the time. It's like religion, right? I'm
Yeah.
anti-dogma, right? Whether it comes to religion, whether it comes to health, I'm anti-dogma. And
Yeah.
we see that in religion. The Catholics have a slightly different approach to the Protestants, but they're right and the Protestants are wrong. And then the Jews
Yeah.
have a lot more of and then we look at this. And so we look at the diets that way. I have a whole 30-hour module in our program that's the food religions. I don't call
Mm.
it that. I jokingly call it that, but
Yeah.
it's the
Yeah.
food religions, right? And everybody wants to be right as opposed to everybody having a piece of the pie. I saw a quote that was supposedly attributed to Gandhi. Every religion has a piece of the truth. And
Mm-hmm.
when we look at the food dogma, the food principles, except for the standard American diet, I would
Yeah.
say that most of them have a piece of the truth. And we have
Yeah.
to find for each individual what's the right piece of the truth and how does that fit into them from a genetic standpoint, from a cultural standpoint, from their age, all this kind of stuff as to what works best for them. And yeah, people can go from the standard American diet to any of those diets and do well for a while. You
Yeah.
go from standard American to paleo, to macrobiotic, to vegan, to what else? Carnivore, anything. You're going to get better because you've taken out all the garbage food. You've taken out all the processed food, right?
Yeah.
You've usually done in such a way that we keep our insulin and glucose levels relatively stable, although something like maybe macrobiotics, which is high grain, maybe not, right? So, but we go from there. And plant-based is saying keto is trash. Keto is saying
Yeah.
plant-based is trash. What if you could do plant-based keto or keto-like diet?
Yeah.
What if you can adapt your diet to what your body needs? This is the amount of fat that my body needs versus the standard keto is here, right? I'm not a big fan of butter and bacon as health foods. And that's what so many people are promoting on a keto diet. And that's why it works for a time and then it doesn't. So we need to treat each individual as an individual and help them to be able to customize their choice. And the belonging, yeah, I get it, right? Yeah, I just left the paleo tribe because I
Yeah.
started to eat legumes, right? I started to eat lentils, so I'm thrown out of the paleo tribe or
Yeah.
whatever it might be. Oh, I'm thrown out of the plant-based tribe because I have fish twice a month, right? So we want to belong. But the truth of the matter is, you're going to be on the you diet. I'm going to be on the me diet. Everybody's going to be on the diet that's right for them if they truly want to be healthy. Do they have to avoid lectins, as one famous doctor is telling everybody? And do they have
Yeah.
to avoid oxalates, as another one is telling them? And do they have to avoid FODMAPs? Well, for periods of time, there may be some disruption in the biochemistry, in the enzymes, in the gut flora, whatever it is, that makes you need to follow a specific restrictive diet. Does that mean that that's the diet you need to follow for the rest of your life and that that's the right diet for everyone? No, no. I don't believe that. I
Yeah.
believe that whatever diet it takes, for example, we had a woman who went through our sweet spot solution program, which is all about balancing blood sugar, and she did great. And it's a higher fat, mostly plant-based. You can have a little animal protein, higher fat to put you in a mild state of ketosis, but you're measuring your glucose to see what takes you out of the ideal range. And so she did great on it, got her husband to do it. Her husband failed on it. Her husband couldn't tolerate it because there wasn't enough fruit, there wasn't enough whole grain. He added in some whole grain, some wild rice, some lentils, and more fruit. He thrived. Okay, so everybody's different. We have to start with a base, a core, with certain principles, and then we go from there. M&Ms, they don't belong on any of the diets, I don't think, if you want to really be healthy, right? But for the most part, whole foods from nature, you figure out the balance between it for each individual and what keeps those levels stable. And I think measuring glucose on a regular basis, whether it's with a CGM or whether it's with finger pricks, and measuring insulin and getting a baseline, because so many people are hyperinsulinemic, their insulins are up through the roof and nobody's telling them, oh, you're fine, your fasting insulin's 20, but you can't lose weight, but you're having all these other issues. Well, that's not a good level for fasting insulin. Let's get it down.
Mm-hmm. Amazing. So many threads there that I want to go down, but for the sake of time, because we're nearing the end, I'm going to probably just go down one more string and then we'll wrap it up.
Okay.
You know, what you just said 100%, you know, I agree with, is there's just not going to be a way for you to do anything long-term that's, for example, like too restrictive. Like if you ever wanted to have some fruit, but you're like, oh, I'm keto, I'm not allowed to have any fruit, and you're in Hawaii, you know, everyone's having fruit. It's
Costa Rica.
Costa Rica, you know, it just, you're going to be in situations in your life where there's going to be something that's against what you want to do. And so it's like, how much willpower do you want, or are you never going to do those experiences? So I think, and then also, like you said, sometimes I have friends that have done keto and they hated it. Absolutely terrible. Some of them did it completely wrong, never actually got into keto, which is another story, but some of them did, right? And it was like they just didn't feel as good as some other people, which is, you know, can be subjective and or other variables.
Yeah.
But so that being said, I think having something that works for you day to day, you can do forever, or have a decision matrix where you're like, okay, well, I might have the tacos now. When I was in Mexico, I would time my tacos if I had a workout and I walked 10K steps, because then I could see I was wearing a CGM. It almost had no impact. If I didn't do that, it would have an impact. So it was like, you know, there's ways you can fit these things in, like you're saying. But there is a couple things or times you've hinted at being plant-based. Is that, do you try to get people at the end of the day to just have more plants and vegetables, or majority of their diet ends up getting there, and then whatever they add here or there is fine? And if so, if I'm not, you know, projecting what you're saying or what you think, correct me, but then if that is true, over your years of experience, how did you land at that's probably a lot of the time going to be optimal, given that you're going to, you know, like you said, maybe add legumes here or different types of vegetables, you spike with pineapple and somebody else doesn't. So like those will have to get personalized, but is it the baseline ends up being, in your opinion, and with your experience with all your clients that you've taught, is it plant-based somehow just has a winning spot for you, or is it something else?
That's a great question. And yes, it is. And over the years, that's what I've found. I came into it from me going plant-based, me fasting and then going plant-based and getting my health back, right? And so reading a lot of the plant-based literature, and it's like, oh, this is the way for everybody. Then I started to work with people and I realized some people don't do well. They need to have a little bit of animal protein, but there's very specific guidelines and, you know, how it's raised. So, but I do, all of my recipe guides, all of my videos are all 100% plant-based, because here's why. If somebody decides they want to do it plant-based and they join a program and theirs is a mix, those recipes are like next to impossible
Yeah.
to convert unless you are Julia Child, right? It's just, so we give them the base and then we say, hey, if you need a little bit of animal protein, add 3 ounces of, wild caught salmon, or add 3 ounces of, buffalo, or add 3 ounces of something that's, not commercial.
Yeah.
Hormone loaded with, not bacon and butter. I'm sorry. I'm anti-bacon and butter. I think that they're so processed. They're not real food. But I find that most people do well. Why? You look at the studies, you look at all the phytochemicals, you look at all the protective effects of plants. It goes without saying that people are going to do well. Now, the carnivores will tell you the opposite, that plants are bad, don't eat any. This is a short-term experiment they've only been doing for a very short period of time. And yes, some people do well when they remove all that fiber for a while and allow their gut to heal, allow the food sensitivities to heal. But then there's a time where they need to go back. There are a lot of people who go completely vegetarian, vegan, and then they decide that that doesn't work as well for them for whatever reason. They don't absorb the proteins as well. Maybe they're doing it wrong for them. I will hold to that because a lot of them are not doing it right. Because there's a lot of foods that are plant-based that are garbage. And I had a picture of that in a presentation I did earlier today. It's like, not all plants are good for you, right?
Mm-hmm. Yeah.
Jelly, most jellies are plant-based. But is that good for you, right? So we want to find the best food for a person. And when you get it all out, when you get everything out, and then you add things back in, that's when you can really see how things go.
Gotcha. Okay, we have a couple more minutes. I'm gonna dive into a couple more things on this topic, and then we'll definitely wrap it up. Just because I'm interested, I want to push it. But it's interesting you say that because I've talked to people who had the opposite reaction where they said some fruits, some vegetable is fine, and these doctors as well too who are touting this, but really, if you look at like a nose to tail diet, not just eat the muscle, which is like the least nutrient dense thing in an animal, for example. If you eat a little bit of liver and you eat heart and brain, and liver has like pretty much every vitamin, for example, and mineral that you can have other than one. Eggs are, I think, other than vitamin A, have pretty much everything, including like a codeine, which is, from all the research I've done, pretty deficient in a lot of different foods if you're not getting it from an egg or supplementing, for example. And, for thousands of years, they'll argue we started eating animals, and then when we could find vegetables or fruit, we would eat those in seasonality, right? So going a little bit back to it's going to vary, of course. So we're not saying this is just a hypothetical philosophical conversation between us, because I would love your point of view of people who argue that side of things versus like, the plants have all these, amazing micronutrients, but then people will say, yeah, but then a lot of vegans, for example, are really deficient in a lot of things. And then they resort to taking like a pea protein so they can get some more protein, and that's highly processed, right? So there's a lot of these arguments
Arguments back and forth.
Yeah. And it's like, so you still landed at plants, and I'm just wondering what you would say to somebody arguing what I just said, which is like, animals, nose to tail, has been around for a long time. Even if you add a little bit of vegetables or fruit, it's fine. But you're getting macro and micronutrients this way, which is very calorically satiating because you're getting fat, protein in large quantities, right? And therefore, it's easier to go a longer time without eating. So how would you kind of...
Yeah.
I'm sure you've looked at this literature, right? Given our
I look at the
conversation.
literature, and you can find literature to support whatever you want to support.
Always.
Right? And they can say, we go back to this far, but if you go back to this, with the teeth structure, you weren't living there. There were not scientific studies. There were no medical journals. There, we're going by people's interpretation.
Exactly.
And we can interpret it the way we want to interpret it. I like to go by how people respond clinically.
Okay.
And personally, what I've seen, and this is not a judgment, but what I've seen is I feel amazing at, mid 60s. And I've been eating nothing but plants for about 38 years. Okay. People say, oh my God, you should be dead by now. If I weren't getting the nutrients, if I weren't getting the proteins that I need, I wouldn't develop muscles and biceps when I lift, right? I would have immune system problems and I would be getting sick all the time. I don't, right? So from my perspective,
yeah,
it works. Animals, to grow animals in a safe way, they need to be organically raised. They need to be out in the pastures. And yes, tail to toe. That's not the way people eat animals.
No,
even the people who claim that they're carnivore and they're doing this and that, they go to restaurants and they eat the crap they serve in restaurants, excuse me, but they're eating the ones that have been hormone fed. They're not grazed. And people say, well, I just do it when I go out. That's when you should be vegetarian. That's when you should eat just plants, because there's less damage to eating a non-organically grown plant than to eat the hormone-laden, pesticide-laden flesh that you're going to get in a restaurant. To be able to support the entire population of the world eating primarily meat, we would have to knock down the majority of our cities, because to do it in a way that is ethical for the animals and healthy for the person, so that we don't need to, pump them up, and they are given the grazing room. We don't have enough grazing room on the planet, right? We already know that McDonald's knocks down rainforest to make grazing, and they're not even doing it ethically, and they're not even doing it in a way that's pastured, right? We look at that. The world couldn't sustain it for everybody to eat that way. So then it becomes what only the elite can eat, and everybody else is relegated to whatever else is left. Plants are relatively easy to grow. They grow everywhere. And when people say they've done a vegetarian diet or a vegan diet and they got sick and all, when I actually asked them what they were eating junk vegan.
yeah,
right? They're eating junk vegan. They're eating soy sausage meat. Like, come on, right? So I think that we just have to look at each individual, and we have to look at whole foods. Some people do have problems with oxalates and they can't tolerate them, but usually when they get their guts healed, they can tolerate them, right? And there's ways around it. So there's just a lot of complications right now, because we're not back in the Stone Age, right? We have air is polluted. The soils are polluted. The water is polluted. The animals are raised in confines. And we just don't have access to really, on a large scale, the kind of animals that would be grown so that it's organically raised, pastured out there, wild, not cultivated, and that people are eating them tail to toe. Come on, we don't do that. You go to a restaurant, you get the muscle. That's it.
Yeah.
Yeah.
Okay. Man,
that's my opinion.
Yeah, no, I love that, and that's where I wanted to go with it. I think there's like seven interviews we could do on just that alone, which is awesome. But I'm gonna wrap it up here. I promised I wouldn't keep digging. Amazing interview. Thank you so much for being on. I wanted to let the audience know, or whoever's watching this or listening, how can they find you? What's the best place to go interact with you? And if you can give us that, and we'll link it down below as you're talking.
Okay, great. Yeah, so drritamarie.com is my main website. inemethod.com is my practitioner website. And I'm on social, on just about every platform. It's Dr. Ritamarie, Dr. Ritamarie, Ritamarie. Facebook, Instagram, LinkedIn. I don't think I'm on Pinterest. I might be. I don't know. I have started a little bit on TikTok, but I haven't done much there yet. But that's where I'm at. Dr. Ritamarie, Dr. Ritamarie.
Amazing. So go follow her right now, guys. Go check out all her content. As you can see, a wealth of information. And we went through many different topics. I'm sure I'll have you back on to dive into some of those other things that we didn't get to, but really appreciate you being on. It was amazing to have you, and we'll do it again sometime soon.
Great. Thank you so much.